back. We missed you over Thanksgiving week. We hope everybody had a wonderful holiday, but we are very, very excited to be back. So I'm extra excited because I get to be the patient today on something that I just found out was even possible a couple days ago. So I had approached Dr. Polo about my earlobes, and we actually did one and not the other. If you look at this ear, my earrings completely droop. Whether it's heavy earrings or light earrings, it doesn't matter. They completely droop down. I thought I was gonna have to undergo a full earlobe repair, cut it open, sew it up, wait, re-pierce it, the whole thing. And then Dr. Polo surprised me with the beautiful idea of putting filler in my earlobe, and I got very excited and wanted to show you guys the whole process. So he's gonna tell us a little bit about what's going on, but you can already see this ear was already injected, this ear was not, and you can already see the difference of how that earring holds and that does not really hold anything. And it's such an easy, quick, it was painless. You'll see it happen on this ear now. I literally did not feel anything. And my earrings look pretty. I can wear beautiful earrings again. It's very exciting. Very exciting. I get to go shopping now. So Dr. Polo is going to tell us exactly what he's using, what he's doing, how he fixes it, and all of that. But we definitely wanted to share this with you guys today. So we're very, very, very excited. I'm going to take this out so he can start showing what's going on here.
Okay. Well, I'm going to talk while we're doing the procedure, because we want to get this done and let everyone have the chance to see the procedure. But, you know, we don't want to make people think that they need to be self-conscious about their earlobes, of course, you know. God knows there's plenty that we need to worry about in life other than our earlobes, but this is a common problem that we address. And we kind of see it in two populations. We see it in younger patients, starting in younger patients when they start to have the exact problem that Sophie's having, where their earrings, they're not happy with the way the earrings look. There's not enough support in the earlobe for one reason or another to support either heavy earrings, or sometimes it's even the smallest earrings where they tend to sag and droop a little bit. So patients like Sophie, where, you know, so there are two different things that can cause those problems with the earrings. Either the piercing site has dilated and spread out so that there's not enough support immediately around the piercing site to hold the earring up, or there's been a little loss of the connective tissue and the strength of the earlobe itself, and loss of that connective tissue support. So with Sophie, the problem is more that connective tissue just sort of loosening up and her earlobe deflating. Her piercing site is not really dilated at all. So we wouldn't want to do the surgical procedure. The common surgical procedure we do for dilating of that piercing site is to actually excise the piercing site as a little circle or ellipse. Or if it's bad enough, we very often cut all the way through the edge of the earlobe and then repair it primarily, and then go back and pierce a separate site. So in her case, you know, the situation is not that extreme, and we just need to try to get better support, connective tissue support of the earlobe to hold the earrings up. And also maybe add a little bit of volume and improve the overall aesthetics of the earlobe as well. The other patient population where we address earlobe aesthetics very often is patients who come for facial rejuvenation. So if we're doing a facelift on a patient, and this will tend to be patients in an older population than Sophie, but if we're doing a facelift on a patient, we're going to want to look at the earlobes. We're going to be making incisions in front of and behind the ear. So if some type of surgical procedure combined with that facelift procedure is going to help the earlobe aesthetics, for example, if the earlobe is too long or too wide, then a lobe reduction, where we actually do like a wedge resection and then close that up with the facelift incisions, can improve the overall aesthetics. What we don't want to do is do a big facelift procedure and then have the face and the neck looking fantastic, but still have earlobes that don't, ears entirely, that don't match the aesthetics of the face. So in this case, again, now we're just going to solve the problem with the fillers. Now we want to make it clear to everybody that injecting the earlobes with dermal fillers is off-label use of these products. So there are certain FDA indications for injection of all the different, whole spectrum of dermal fillers that we have now. None of them have FDA approval for earlobes. It doesn't mean that it can't be safe and effective in the hands of an experienced injector. But we don't know now, and there's not scientific evidence really to tell us which of the injectable fillers we have that will be best for this particular situation. Or, in each individual patient. There may be one filler that's better for Sophie, then there may be a different filler that's better for a patient who has a different sort of circumstance and maybe different changes that we're trying to address. So what I'm going to use today, we're going to use a Radiesse, which is a non-hyaluronic acid filler. This is a calcium hydroxyapatite filler. So it's safe to be injected in deeper in the skin and into subcutaneous fat layers. If you take a cross section of an earlobe, there is some fat in an earlobe. The earlobe is kind of like a sandwich of skin, front and back, and then inside there's a little bit of fat, and then right in the middle is a very thin layer of connective tissue. And that's probably the fat has probably decreased in volume in Sophie, which is common.
So it's a good thing to lose fat. I just don't want to lose that much fat in my ears.
Right.
Trying to wear pretty earrings, guys.
That connective tissue has probably also lost some strength. So one nice thing about the radius filler that we're going to use today is that it works a little bit differently than the hyaluronic acid fillers, and the microspheres in the radius are consumed by some of the cells, the macrophages, and it stimulates them to release signals that stimulate collagen production. So that's what we're trying to do, is get some tissue regeneration here and get some more of her own collagen to help support the earrings and hopefully solve the problem. So we're going to do some injections. We did the other side earlier, like Sophie said. She's got some swelling now, so it's a little bit larger than it's going to be in the end.
A little fatter than it will be.
But immediately afterwards, when we'll demonstrate this now, she had nice increased support in the earring. We're going to put a little stud earring now and show the change after we do the injection.
This was the biggest difference that I saw in the other ear. Wait until you guys see what happens. It's crazy.
Right. So I'm going to try to do a little crosshatch treatment. I'm going to inject in front of and behind the piercing site, and then I'm going to inject above and below. And we're going to try to add volume and get some of this filler material in there where it's going to eventually add connective tissue support and help support her earrings and give her a little bit better aesthetics with a more plump and full, younger looking earlobe. Right?
Younger looking. I'm not even that old yet, and we're already talking about making me younger. I'm only 30, but apparently my earlobes aged earlier than they were supposed to. But
okay, we're going to prep like we always do. And we've had some numbing cream on. Sophie was using that topical anesthetic earlier. She tolerated the other treatment very well. Right?
I didn't even feel the other side.
Mm-hmm.
I really didn't feel it at all. That topical numbing cream is fantastic.
Right, on the earlobes here, it really is effective.
Yeah.
Okay.
Dr. Polo, how long should this last on my ears? How often would I need to do it?
Yeah, the radius typically will last up to 6 to 9 months, and that's just the volumizing effect from the injected product itself. Again, we hope to have some added collagen synthesis and collagen production, and hopefully we have some permanent effects of this.
Do we have the stud so we can show them how it droops before we
right,
fill it?
Right.
This is what
I
was completely wowed about, because on the other ear, when I first put it in, it was just kind of drooping down, and we're talking a tiny little baby earring stud. It was just kind of drooping down. Once we were able to fill it and we really got that space, that support in my ear, without even putting a back on the earring, it just kind of sat there and it stayed there. So I was like, let's see how long this is gonna last just sitting there. I went to lunch. I was gone for about an hour and a half. I came back, forgot the earring was even in my ear, and when I looked in the mirror, it was just sitting perfectly right in my ear. Which I haven't had studs do that in I don't know how long. They're just constantly falling. And people are always telling me that I need to fix my earring. Your earring's about to fall out, your earring's about to fall out. Not anymore.
Okay, so this is the same stud that we use on the other side. These are the ones that we use for piercing. Okay? Now that's just in without the back. And we'll sit up.
And it's just probably falling. I can't see it, but I guarantee you it's falling out. Sel, is it falling?
It's falling.
We have Dr. Polo's patient coordinator in here helping us film.
That's me.
So watch how quickly this fills up and is no longer drooping anymore.
Okay.
All right, let's do this. Now, Dr. Polo, actually a question I hadn't asked you yet.
Mm-hmm.
Is there anything I need to avoid doing? Anything I need to think about now with the filler? Should I not be touching my ear or playing with it? Or
No, I mean, this is just like having filler injections anywhere else. We, in general, we don't want you touching or massaging or manipulating the injected filler. We hope that we have everything exactly where we want it. I tell my patients always if they see or feel a lump after the treatment, sometimes some of the swelling goes away and there's a nodule that is visible or palpable, and
Okay.
I'm fine with patients manipulating that. Botox, we don't have patients massage. Of course, that's in a
Right.
solution, and we don't want to spread that and distribute it anywhere else. But if there's a nodule from the filler material with more of the volume deposited than we want in any specific place, it's
Okay.
fine to do a little massage. And early on, you can manipulate it and shape it and flatten out a bump or a nodule. I did want to show, you have nice youthful earlobes, but you do have some volume loss for sure. And some of the typical changes that we see in the earlobes as we get older are loss of volume and thinning of the earlobe, and as it thins and loosens and the connective tissue loosens, we get elongation of the lobule and also sometimes spreading and widening of the lobule. And then at the surface, sometimes we start to get creases, fine creases in the skin and even folds. So, you do have some changes in this, and I think this is the worst of the two earlobes. And you are even beginning to get a little bit of a fold there that's right along the piercing site. So these are the things that, depending, affect how we select which filler we might want to inject in the lobules. If you have a crease that we want to fill and erase, we're going to use something, hyaluronic acid, that is safe to inject more superficially. If we're trying to just add volume, we're going to want to use either a more concentrated cross-linked hyaluronic acid or something like this Radius.
Got it.
And we were talking earlier about options for patients where we're doing facial rejuvenation procedures. And if we have a patient under anesthesia, we'll have the option of doing some fat grafting as well.
Oh, okay.
So I'm in between those two layers of skin, anterior.
Oh wait, you already went in?
In the fat layer, yes.
I didn't even
Okay?
feel
And
that.
hopefully we can see this, and Sel can see this, where we're injecting just behind the piercing site there. Okay?
Guys, I had no idea he had already injected the
We're
ear.
trying to use the same puncture. Now we're going to go back behind the piercing hole.
It's just amazing that this is such an easy treatment. I literally I don't feel it. I actually would have thought that my earlobes would have been more sensitive and I would have felt it, but I don't. And it makes such a difference.
Yeah, and on the other side, we did a total of about 0.5 cc's. Now I'm going to complete a sort of this cross-hatching technique. This is what I like to use in this kind of case. And inject sort of as a hashtag shape, above and below and front and back of the piercing site. Okay, now that's about the same volume that we did on the other side.
Are you done?
Mm-hmm.
That's it?
We may do a little touch-up now, but that's it.
Guys, however long that took, just double it. And that's how long it's going to take you to have both ears done. So what was that? Maybe 60 seconds? 120 seconds?
Yeah, we're going to compare with the other
So,
side. Now the other side again.
we're
has a lot
talking
of swelling.
5 to
This
10
is
minute
good for
treatment.
cell to capture because again we've already got a lot of swelling on the other side, and that shows pretty much how this side should appear when we're finished. We may do a little bit more volume. Again, this side I think is affected a little bit more. By
This side was definitely
by the
my worst
volume loss
side.
that you have, yeah.
They were
So
both pretty bad, but this
we've got
side
an
was...
equal volume to what we have on the other side, but we're going to put the earring in now. And we'll compare, but I think we're going to go back and put maybe another 1/10 of a cc here.
Okay.
And most of these fillers we have, this is a Radius, a 1.5 cc syringe of Radius, but most of our hyaluronic acid fillers come in 1 cc syringes, and there may be a tiny little bit of a bonus of a 1/10 of a cc. But we've done 1 full cc now, and I think for most people, 1 cc is going to be plenty of volume. You may end up doing 1.1 or 1.2 in your case. Okay, so now the piercing hole is already more snug because of the added volume we placed right around it, and it looks like it's really supporting the earring better. And again, we may go back and put a little bit more volume in. Let's sit up and everyone can see the difference.
Look at that earring just sitting there. Is it crazy to say that I can feel it not falling out of my ear? Does it sound weird? Because it doesn't feel like it uses, like a lot of times it just feels like the earring is just
your earlobe,
pulling
right.
it.
And we can show that one compared to the other. You see how much swelling you have in the other. And
It's a little
that's,
swollen.
Yeah, that's just from the
I also
time
get
you
swollen
cast.
very easily.
Yeah.
Some people don't, some people do. I'm one of those people.
Yeah, but this is what
that's
we
okay.
expect your result to be after. I'm sure this one's going to start to get a little swelling now. Do a little ice now when we're finished. And later on this evening, maybe once in the morning tomorrow, and it'll be fine.
I can't believe how fast and simple this is, and I had no idea that this was even
Yeah. Let's do a little bit
an
more.
option.
We'll do a little bit more
Let's
on
do
this
it.
side, and then
Whatever you
we'll,
think,
and
Dr.
then we'll
Polo,
try-
you know. You're the expert.
Then we'll try the other, the bigger earring and see what the difference is there. Okay?
Sal, you're so quiet today. Are you just fascinated with my ears?
I'm just trying to stay focused. This is really amazing. I'm looking at this and I'm just,
I want to get
I'm in
more
shock.
volume right above the piercing site there, just to match the other side.
I was showing Sal this morning with my lightest possible earrings. And he was like, wait, what? How? You're so young, apparently. My ears are a lot older than they should be. I should stop laughing if there's a needle in my ear.
well, now you have Polos. So
I
you're
do
all good.
have Polobes, Dr. Polobes.
You're all good
The expert
now.
of the earlobes. It's incredible.
Wow.
And I didn't need to undergo the whole cut through, stitch it back up, wait until it heals and re-pierce. Sometimes that's necessary if you have, you know, if your actual earring hole is completely stretched out and things like that, but that wasn't my problem, and I was hoping to not have to do that.
Now, Dr. Polo, are some people just born with earlobes like this, where they're quite thin like
yeah,
that?
yeah, definitely there's some variation, and I think some people just naturally have thinner earlobes with less support. But I think we all lose volume and that connective tissue support over time. And I think it starts to happen, fairly early, definitely in our 30s and 40s, and especially in anyone, men or women, who are wearing earrings and especially larger, heavier earrings.
I like the large, heavy earrings. They're prettier. They're so glamorous.
They are.
Look how beautiful these things are. These are my evening wedding gala earrings, but how beautiful is that? And they looked so terrible before when I would wear them because they would just droop. And now big earrings are such a big thing.
Let's try that heavier earring.
Let's do it.
You have the other?
Yep.
Okay.
All right, guys. It's a moment of truth.
Yeah. But I think,
Dun, dun,
it's,
Dun, dun, dun.
what we don't know is, we know about the safety of the different fillers and which are safe to use here and how.
It's
But
got no back on it.
I think
Is that? I don't even have a mirror, but that's holding
Yeah.
there without a back, isn't it?
Wow. Wow.
That's just holding it without a back. And these are heavy earrings, guys. They're not just...
Oh,
let's see the other side.
that lobe looks great.
That's a little swollen, but like I said, I swell you flick my elbow and I'll swell.
I think we can get a little touch more on that side also, just underneath the piercing.
On the
side.
bottom.
Yeah.
Whatever
Wow.
you
Those
think.
heavier earrings. She's really testing it.
I get you.
But look how much more
now.
supportive they are. They're supported.
Yeah, definitely.
Wow.
I mean, I can feel it. Even when I put the earring in, it's not falling. It's not going under, which is what they would always do. They would go under, and
Right.
you would lose the earring. You wouldn't be able to
Yeah.
see what I was wearing.
Yeah, you needed more stiffness in the earlobe there. Looks great.
It's there. Look at these
Yay.
beautiful things and these beautiful earlobes.
Love
You know,
it.
with these beautiful polobes. I gotta use that.
Hashtag Polos.
Thank you, Dr. Polo. This is
You're welcome.
amazing.
All right.
All right,
Let's finish
guys. Thanks for joining
great.
us today, me and this crazy hair. We'll be back soon. We'll be back. We've got lots of treatments coming up before the end of the year, so make sure you're tuning in next week and the following. Happy holidays, and come get your polobes. Bye, guys.
Thanks.